Removable orthodontic appliances. These are the appliances which are inserted and removed by patient at will. Initially they were made of precious metals, but nowadays they are made of stainless steel wire and acrylic. The advantages: they help maintain the oral hygiene and require less chairside time. The oral hygiene maintenance is due to the fact that it can be removed by the patient after intake of each meal and cleansed and worn again. Then are the disadvantages. It requires patient cooperation and compliance. Unless the patient is ready to wear the appliance, we cannot have the complete effectiveness of the appliance. Then second is it corrects only slight malocclusions, for example tipping. It cannot be used for uprighting, derotation and bodily movement of teeth. Parts of removable orthodontic appliances. It has three components, which are the active component, retentive component and the base plate. In the active component, we have the mnemonic BRESS, which stands for bows, retractors, elastics, springs and screws. Active component is the one which exerts force and causes the tooth movement. Second is the retentive component. It includes the clasps. These are the components which hold the appliance in place. They are not supposed to exert any force and cause any tooth movement. And then is the base plate. It is mostly made of acrylic and helps to embed the arms of both the active and the retentive components. In the retentive component, we have the clasps, and they are of the following types. First is the C clasp, which is also known as a circumferential or three-quarter clasp. It is easy to fabricate, but it cannot be used in partially erupted teeth. It engages the buccocervical undercut and one of the proximal undercuts. And second is the U clasp, which is also known as a Jackson's clasp or full clasp. It was given by Jackson in the year 1906. It engages the buccocervical undercut and both the mesial and the distal proximal undercuts. The advantage with this is that it is easy to fabricate, but the disadvantage is that it cannot be used in partially erupted teeth. Then we have the Adams clasp, which is also known as the universal clasp, modified arrowhead clasp and the Liverpool clasp. It was given by Adam in the year 1950. We'll study about it in detail in a while. Then we have the Southend clasp. It is used in anterior teeth for retention. The wire is adapted along the cervical margin of anterior teeth. Then we have the triangular clasp. It is used between the posterior teeth. It engages the proximal undercuts and again is used for additional retention. Then we have the ball end clasp, which is also known as the pinhead clasp. It is similar to the triangular clasp, except for that at the end it has a ball which is either made of silver solder or preformed. Then we have the Schwartz clasp, which is also known as the arrowhead clasp. It is the predecessor of the Adams clasp. It has certain disadvantages, which is first that it requires special pliers for the fabrication of arrowheads. It engages a lot of space in the buccal vestibule. It can cause damage or trauma to the soft tissue and is difficult to fabricate. And at last we have the crozet clasp, which was given in the year 1920. This is similar to the U clasp or the full clasp, except for the fact that it has an additional wire which engages the mesial and the distal proximal undercuts for additional retention. Now, the Adams clasp, it was given by Professor Philip Adam in the year 1950. For posterior teeth, it is fabricated using 0.7 mm wire, and for the anterior teeth using 0.6 mm wire. The parts, it has three parts, which are the two arrowheads, bridge and two arms. The two arrowheads engage the proximal undercuts. The width of the bridge is calculated using the formula, that is 2/3 of mesiodistal distance, or the distance between the mesiobuccal and the distobuccal cusps. And the two arms are the retentive components. The advantages: it is rigid, so more retentive. It can be used in both deciduous and permanent teeth. It is used for both anterior and posterior teeth. It can be used in both partially and completely erupted teeth. It requires no additional pliers for its fabrication. It requires minimal space for adaptation and has multiple modifications. The modifications are Adams with single arrowhead. It is used for partially erupted teeth like the mandibular third molar. Adams with J hook. The hook is used for engaging the elastics. Adams with helix. It is again used for engaging the elastics. Adams with additional arrowhead. It is used for additional retention. Adams with soldered buccal tube. It is used for extraoral anchorage by face bow headgear assembly. Adams with distal extension, it is used for engaging the elastics. And finally, Adams or incisors and premolars. Thank you.